Hello and welcome to Pure Health News. I'm Bronwyn Eisen, and today we will be talking about cosmetic dentistry, and we have the pleasure of meeting with Dr. Chris Stevens. Welcome to the program.
Thank you very much.
Great
Welcome.
to have you here. Now, you're known all over the country as a cosmetic dentist, so why don't you tell me a little bit about your background?
Well, I graduated in 1981 from Marquette, and at that time there really wasn't cosmetic dentistry. Dentistry was quite technical. But the industry really got away from the metal look, the silver fillings, and people started requesting looks that were younger, healthier. So it was a natural progression into cosmetics, and that really has drove our practice because we see how it changes people's lives so wonderfully. And as far as my training goes, certainly we had advanced training for myself, but what was so fun was that during that advanced training, I had people coming to me and asking me, would I be interested in providing teaching to them?
Okay, so you're a teacher as well then?
That's a wonderful addition to the dentistry that I do. We teach nationally, internationally, and one of the greatest rewards is that I not only am able to help my patients, but indirectly through my teaching, I'm able to help patients all over the world. And that is a fabulous feeling.
Dr. Stevens, why did you choose cosmetic dentistry?
It's really because of the impact it has on patients' lives.
And what do you mean by that?
Well, if we really think about it, no one likes to come to the dentist.
It's true.
But what's interesting is how happy they are when they leave. After we've transformed their smile, we see it weekly, that people are just thrilled with the results that they receive here.
So you really feel as though you're changing lives?
We do. On a regular basis. In fact, just a short time ago, we had a lady come in, and she's a teacher, and their children were making fun of her teeth. And you know, children, they can be very forward. And so she tended to cover her smile with her hand. She came in, we designed a smile with her, one of her choosing. We did 10 veneers for her, and you know, the next time we saw her, she had a whole new hairdo, and she looked fabulous. She looked totally confident. She truly was a different person. Dr.
Stevens, what are some of the frequently asked questions that you hear?
Well, there's a couple very common ones. Probably the most common one is it expensive? And it doesn't have to be, because there's such a variety of techniques to help people's smile look better. Whether it's whitening, to just 1 or 2 veneers, 2 more veneers to enhance.
So it's just going to depend on what the person's case is.
It really is, and what they want. That's what we work so hard to do, is understand what their desires are and what might be necessary to help fulfill those desires. And as a matter of fact, we've never had a patient, after we've finished their smile, say that it wasn't worth it. In fact, what we hear is, I don't know why I waited so long to do this. Another frequently asked question is, will it be uncomfortable?
Pain.
Pain. Everybody comes in wondering if it could hurt. And we have so many techniques available today to make the experience more comfortable for them. We see it on a regular basis, that people come out and say, that was not as bad as I thought it was going to be. And as a matter of fact, we've never had a patient, after we've finished their smile, say that it wasn't worth it. In fact, what we hear is, I don't know why I waited so long to do this.
Now let's go back to the story about the teacher that you told me about. You mentioned that she had a role in choosing her own smile. What did you mean by that?
Well, some people ask us to design the smile, and we choose smiles that fit them as we see it in our artistic abilities. But some people request a certain smile. Maybe someone says, I want to look like Julia Roberts, and so they bring in pictures of what they want to look like, much that ladies do in the hair salons. They choose a style. So we work with them to help them achieve the desires that they have.
And it's going to fit their facial structure.
That's one thing we work so hard on, is making sure that the smile doesn't look like its walking smile, that it fits with them. Bronwyn, there's no doubt that I take great pride in my work, but there's really no such thing as a Dr. Chris Stevens smile. What we want is smiles that work with that patient, fit that patient, and look natural. And what we hear from patients is when they come back, they say, people don't know what I did. Did you change your hair? Did you have any facial work done? Were you on vacation? Have you been tanning? Something is different. And that's what we enjoy so much, is that the smile doesn't stand out, but yet it fits within the person.
So it looks so natural that people are questioning what's new about that person.
That's what we hear.
Let's talk about a timeline, say from start to finish, from the initial consultation to the person having a brand new smile.
Well, once a person commits to having this done and wants it done, we'll meet with them to design the smile. Although my staff and I are going to play a guiding role in this, it's really important that we work together as a team. So we'll ask questions about shape, size, color, all of those things to make sure that the individual gets what they want. And our next step is the temporaries, where we have try-in veneers. It's a roadmap to the end result, so they can see how they are going to look with veneers, because many people come in with a picture of someone else,
Sure.
don't know how that smile will look on them. So the temporaries are try-in veneers. We can make changes as they request, after family, friends have had an opportunity to see them. And 4 weeks later, we've got them.
So you're saying that the temporary, if they don't like a certain way that a tooth is shaped, then you can go back and kind of even reconstruct from there?
That's right. The temporaries provide that try-in smile. And that's really our wow moment, because that's the biggest change. They came in with their old teeth and go out with their new temporaries. And once we have an opportunity to see them, we can make small changes if they need to. It's very easy to do, to make sure that the final veneers are exactly what they want.
Mm-hmm. So you're saying that in a matter of 4 weeks, someone can have a brand new smile, or it could maybe even take less time or maybe more time depending upon the patient's needs.
That's correct.